Hey there, it's Dr. Heidi Wroebel coming to you from my office, Feel Good Chiropractic in Brentwood, Tennessee. We are conveniently located 15 minutes south of downtown Nashville off Highway 65. So today I wanted to address one of the most common questions or reservations that I hear about chiropractic care. And I was just talking to a new client about this yesterday. And she asked me, how often am I going to have to come see you? And I heard if you go see a chiropractor, you have to keep going forever. So this is a common thing we hear in chiropractic, and I wanted to break it on down for you and talk to you about it. I've been practicing for 18 years, so I definitely have an opinion on this, and I would say that I am a philosophical chiropractor. So what I want to say about chiropractic care is people use it in different ways. Some people use chiropractic care like a natural aspirin or a Band-Aid, meaning that they wake up, they have some sort of ache or pain, it starts irritating them enough that they decide to go get adjusted, and maybe they go once or twice and then they don't go back again until they have something else happen. That is one way that people use chiropractic care. The type of people that I usually see in my office are people that are dealing with more chronic issues, and they're also people that really value their health and wellness, and they want to actually permanently correct a problem versus like having a tire that keeps going flat and slapping patches on it. The people I usually see are people that want to actually not deal with the problem anymore, not have it lead to other problems down the road, and get it corrected. The average age that a person first sees a chiropractor is 47 years old. Can you imagine if we waited until we were 47 to go to the dentist? Can you imagine if we never saw a dentist in our whole life until we had pain in our tooth? You could imagine what's going on with the tooth. If we'd never seen a dentist our whole life, and then we just go when we have this crazy pain, chances are there's probably a cavity or something funky happening in that tooth. Well, because the general population just doesn't know enough about chiropractic, we don't often see people until they're, midlife, and they usually have something serious going on. So bringing it back to the tooth analogy, imagine how much is going on in the spine before we actually even see them, and the body alerts them with a symptom. So just a side note, we can't determine our health on the presence or the absence of symptoms. Sometimes people feel or look healthy and they've got stuff going on, and sometimes people are expressing symptoms and it actually means they're healthy. That's a side note. So back to if you have to keep going forever. And this also depends on the type of office that you go see. As I mentioned, in our office, we focus on correction, of investigating and really finding out, we're like little detectives, what exactly is causing your pain, getting to the root cause and actually fixing it if that's possible, or slowing it down if it's not possible and increasing your function and decreasing your pain. So at our office, people often will be coming in to see us more frequently at the beginning, usually 2 to 3 times a week for a period of time. And that's when we're doing our intensive corrective care, similar to like if you had a goal to run a marathon and you could only jog around the block, it's going to take you some time and repetition to build up your muscles to that. Well, it takes time and repetition to actually create new neural pathways, neuroplasticity. You can feel a little bit better after 1 or 2 adjustments, but it doesn't mean that that is going to actually create new neural pathways and retrain your neuromuscular system. That takes more time and frequency. That's where the frequency comes in with chiropractic work, where people might not understand, like, hey, why do you have to keep going? It's because it takes that repetition to create those new neural pathways and to retrain your body, because most people, when they come in to see me, are like this. So we don't automatically go from this to this. It takes time. And then typically what happens in our office is that people will come in frequently, and then after we've resolved their symptom and objectively can see improvements, then they're eligible for wellness care, and that is really up to each person. What happens for a lot of people is they never knew how bad they were feeling until they start feeling really good. And then when they start feeling really good and they learn about the power of chiropractic and how the nervous system controls everything in the entire body, and it comes out of our spine, and our spine can get misaligned from physical stresses, mental, emotional stresses, or chemical stresses, they know they're a human being. They're going to keep having those stresses, so they choose to adopt wellness care as a healthy lifestyle habit. it. Just like we continue to eat well, we continue to brush our teeth, we continue to exercise, or we lose the benefit of those things, getting adjusted is something that a lot of people choose to incorporate into their lifestyle because they want to stay healthy, they want to stay active, they want to make sure that they're aging well, and that the last 10 years of their life are not the worst 10 years of their life. And so wellness care is individual for everybody. Some people get adjusted once a week. Some people get adjusted twice a month. Some people get adjusted a few times a year. It's really an individualized choice at that point. And then some people, of course, might come into an office already of having care throughout their life, and they're already more in a wellness care. We're not trying to resolve a health issue. But one of the biggest benefits to getting adjusted regularly is to have a balanced nervous system, a regulated nervous system, so that our body can handle stresses. And when something happens, like a stressful event, we're going to be less likely to get injured, less likely to get sick. And those are signs of a regulated nervous system.